Doctor, can you introduce yourself and share a bit about your experience in body contouring procedures?
Absolutely. I'm Dr. Rani. I'm a board certified plastic surgeon and I practice at Dubai London Hospital. I have been trained in India, Brazil, and Dubai. I'm practicing in UAE since 2016. I initially practiced in a public hospital before moving into private practice. I am passionate about breast and body contouring surgeries. I also perform female genital rejuvenation and non-surgical aesthetics. So these procedures, they not only enhance a person's appearance, but they have transformative potential on somebody's life.
Right, doctor. Doctor, can I know what is the most common cosmetic procedures that you perform?
I perform a range of cosmetic procedures, Dr. Rageena, but the most commonly performed are liposuction, high definition liposuction, tummy tucks, body lift surgeries, breast augmentation, breast reduction, breast lift, female genital rejuvenation, including vaginoplasty, labiaplasty, and also non-surgical cosmetic procedures like fillers and Botox. So most of these patients are either women following pregnancy or somebody who have lost a lot of weight or they simply want to enhance their appearance. So preparing your body and your mind before the surgery reduces not only the risk, it also enhances or improves your healing and thereby the eventual results.
What specific steps should a patient take before surgery for the best result and a faster recovery?
So Dr. Rageena, having few key steps before the surgery is very, very essential. For example, having a stable weight for at least 6 months, having a good nutrition plan, right? If somebody is a smoker, then you need to stop smoking for at least 4 weeks before the surgery. Or if somebody is taking certain medications, it could be blood thinners or certain medications, it could be blood thinners or it could be certain supplements that can thin the blood or certain medications which can interact with other medications during the anesthesia or post-operatively need to be either withheld or modified. So we send patients to physicians who will then take care of these requirements. Apart from this, it is also important to have a solid recovery plan. So making sure that you have somebody to take care of you post-operatively, to help you get out of the bed or go to the washroom or take care of kids, prepare your meal. So making these arrangements before the surgery makes all the difference.
You're right, Dr. Rani. This is what we also provide at home. We take care of the patient prior to the surgery, what all criteria is what you have told, and also post-surgery, our nurses be there throughout the recovery period and do all the things for them, make sure they're taking the right nutrition, give the medications on time, and we provide the best care.
I think what you're doing is absolutely amazing, Dr. Rageena, because see, at the end of the day, everybody wants to feel that they're taken care of properly.
What are the key aspects of post-operative care that should be maintained or followed by the patient for a faster recovery?
So Dr. Rageena, it's important to remember these 3 words, okay? Rest, hydration, and patience. It's very important that you listen to your surgeon's advice. Wear your pressure garment as it is advised. You have to remain active but avoid strenuous physical activity. Remain hydrated. Take nutritious meal. All this is very important. But most important is that you listen to your body. Post-op recovery is not a race. It's a process.
Doctor, how does a professional pain management speed up the recovery and the healing process of the body?
Dr. Rageena, pain management is not only about comfort. It plays a very vital role in patient healing, right? So when pain is controlled, the person moves better, they can breathe better, they can sleep better, and all of this have a very critical role in patient healing and recovery. So a personalized approach, whether it is with pain medication or with lymphatic drainage, or for that matter, non-medical techniques like deep breathing, it makes a huge impact in patient healing.
Okay. Doctor, how can a medical profession outside the surgical team assist in the faster recovery?
Recovery is a team effort. So a patient definitely requires a physiotherapist who takes care of their mobility, the lymphatic drainage. Patient also requires a nutritionist to take care of their nutrition, which is essential for their healing. And lastly, and not to forget, a mental health professional, because a lot of patients, especially when they undergo these procedures, especially the facial plastic surgery, they can have identity issues after the surgery. So it becomes very important that they have somebody to take care of their emotional health after the surgery to navigate through this process.
Doctor, I know you are very particular about the results. How do you select your patients?
So, Dr. Rageena, now selection process depends upon the type of procedure we want to offer, or the type of procedure patient is requesting, right? Now let me tell you, giving an example of abdominoplasty. If a patient has come for abdominoplasty, one important thing is they are physically fit, right? They do not have any medical health problems that can affect their healing, right? Number two is that they are mentally, fit, because 10 to 15% of patients that visit us have some sort of mental health problem. Now, if they do have mental health problems, then we have to refer them to a psychiatrist who may then assess and probably sometimes take care of their mental health, then refer back to us once they are mentally fit for surgery. Now, another important criteria is the body type, right? And also the BMI. Now, if somebody has a very high BMI and say they have a apple type body, apple body type, and most of the fat is concentrated in the abdomen, and they have a lot of visceral fat, and they want to have abdominoplasty. Now, one of the goals of abdominoplasty is to have flat abdomen. Now, if somebody has visceral fat, and even if I tighten the abdominal muscles which separate in the midline after pregnancy, I won't be able to achieve flatter abdomen because the visceral fat still remains. So we then refer them to either a nutritionist who will then take care of their diet, which will help them to lose visceral fat, and then once they lose that fat, they come back, we do operate upon them. And sometimes it might also happen that patients' BMI is so high that they fall into the obesity category, right? So they cannot be offered body contouring surgeries if they think that they want to lose weight, because these are not weight loss procedures. And lastly, if somebody is a smoker, because smoking can impair post-operative healing and can have devastating complications. So if somebody is a smoker, then we have to make sure that they quit smoking 4 weeks before and 4 weeks after the surgery. So these are few criteria that we make sure that patient follows, and then also make sure that patients have realistic expectation, which is so important. Because what happens is, if they do not have realistic expectation and they undergo these procedures, they are not going to be happy. Because one of the challenges that we face is to make somebody happy, right? To fulfill somebody's desire. And if that cannot be accomplished, then neither is the surgeon happy nor is the patient.
Dr. Rani, can you share your success story where a structured plan made a big difference in the recovery?
So, Dr. Rageena, this story comes to my mind where I had a male patient, 56-year-old, who had traveled from South America. He wanted to get body contouring surgery. He had lost around 25 kgs and he had loose abdominal skin, and he also had some amount of abdominal protrusion. When I examined, he had divarication of recti, where the muscles in the midline of the abdomen separate, causing abdominal bulge. Now, he was a chain smoker. And I don't operate on heavy smokers because smoking can have devastating complications after surgery. So I told him that he either quit smoking for 3 to 4 weeks before surgery and after, only then can I operate upon him. Now, he also had some fungal infection in his armpit and the groin because of the hanging skin. And I had to refer him to a dermatologist for the treatment, and also a physician to take care of his other medical health problems. He was hypertensive also.
Okay.
Now he was following up. So he was accompanied by his son, and I sneaked the son's number during the visit to follow up and see if this man really quit smoking.
Okay.
And on the very next day, the son messaged me that Dr. Rani, he's still smoking and I know him, he will not quit.
Okay.
And I thought, okay, I'm not going to operate on this man. He had come for follow-up on day 4. And he was telling me that, Dr. Rani, I have now quit smoking. And I told him, see, I know that you have not, because I have your son's number. And I get to know that you have not.
Okay.
And he told me what happened. So he does the testing of different cigarettes. And that is what he was doing apparently. And I said, I need to still follow up and see how it goes. After day 8, the son messages me, Dr. Rani, he's religiously not touching the cigarette.
Okay.
So I was like, really impressed, like how things are going. So during this time, his fungal infection was treated. His medical condition was quite optimum. 3 weeks before surgery, he had completely abstained from smoking.
Okay.
It's not easy for somebody who is a chain smoker to
Okay.
stop smoking, but he was so determined to get the body contouring surgery done. He was ready to do anything for the kind of results he was looking for.
Okay.
Even post-op, we had provided a home
Yeah.
nurse,
Yes.
right? And like even this guy, he paid huge, and he even took extra 4 nights in the hospital stay. He did not mind. Of course, he was a big man, and he wanted a home nurse to take care of him. So we had provided 1 week post-op home care nurse for him, and by around 2 weeks, he was like up and about. He went shopping, got the clothes he always wanted to wear, and he was like a transformed man. Within just 2 weeks, he was a totally different man. I could see the confidence shine in his eyes. Though he was so wealthy, there was some kind of insecurity that was pulling him down. And this procedure had completely transformed him. Fortunately, the surgery went very well. He was very happy with the outcome. And by around 3 weeks, he was kind of recovered, and he traveled back.
What would be your advice for a person struggling with body image and self-acceptance?
So in today's time, with the impact of social media and everybody trying to show their best on social media, it has become quite challenging for people to accept the way they look. Everybody wants enhancements, right? But then, if you are doing something for yourself, right? When your expectations are clear, that I want, like for example, you have given, you had multiple pregnancy and you have loose abdominal skin, and it has changed, your physical appearance. Like you don't look the way you used to look when you were younger, and you want to have flatter abdomen, and you do it for yourself. That's okay. You get an abdominoplasty, you're happy, that's okay. But if you think that getting this procedure, your personal relationship with your spouse or your partner is going to improve, then that won't be right. That won't be right. So another thing is, there are so many other aspects of your life that you can focus upon. Say you might be an amazing singer, right? You might be a great friend or a great mother, right?
Yeah.
So these are also areas that you should take pride in. right? Not just your physical appearance. That's just a part. Of course, enhancement in physical appearance does improve a person's self-confidence, self-esteem, but your intentions have to be right.
Yes.
That you are doing it for yourself and not somebody else.
What makes you happy being a doctor?
Oh, I think we share this because both of us are doctors. I think, Dr. Rageena, I love to take care of people. I love to make people happy. And I think I'm so blessed that I live in Dubai, where I can help, I can operate or transform lives of so many different nationalities. Where else on planet Earth can I have an opportunity to meet so many people, transform their lives? And believe me, I have made such beautiful friendships through these interactions and through taking care of so many people. And I think it's the most fulfilling journey for me as a person, as a doctor. So yeah, it's just beautiful.
And I feel you're emotional.
Yeah, and I think as humans, we also have to give back to our community. And I think being a doctor, it has given me an opportunity. So I'm a part of NGO which is called as Search. It's in a small tribal village in Gadchiroli district of Maharashtra. So we plastic surgeons, anesthesiologists, we even have some interns. We travel to Gadchiroli to Search 2 to 3 times in a year to perform reconstructive surgeries to the underprivileged sectors of the society.
So Dr. Rani, thanks a lot for coming for this podcast and sharing a lot of information, a lot of knowledge, a lot of stories. I learned a lot from you and it is wonderful having you here. Thank you so much.
Thank you, Dr. Rageena, for having me. And I think what you are doing as a professional, taking care of people who require services at their home is the need of the hour. And I think you are doing amazing with what you do.
Thank you so much.